Democratic Congresswoman Debbie Dingell of Michigan. She's chair of the House Democratic Policy and Communications Committee. Also with us, Chiquita Brooks LaSure. She served as administrator for the Centers for Medicare and Medicaid Services in the Biden administration. She's now a senior fellow at the Century Foundation.
So, Congresswoman, I am curious. The Republicans in your chamber, they are now watching what their colleagues in the Senate are doing. Just how nervous are they about the state of the legislation as it now passes through the upper chamber?
I think there are enough members that are nervous on two sides. One, what's going to really happen to Medicaid? People at home are beginning to understand what the real impact is going to be, that people are going to be thrown off of health care. But not only that, they're going to have larger payments, larger deductibles. It's going to cost them more money. And then it adds to the deficit. Those who want to reduce the deficit, the Senate bill makes an even larger increase in what the deficit would be.
Ms. Brooks LaSure, we've been talking about, I think a very important facet of this is how the American people are absorbing and getting this information into their own ecosystem to understand it better. What are you hearing? What are you seeing on that front? And when this thing gets through the Senate at some point and works its way back to the House, what is the opportunity for citizens to really sort of grab a hold of this and tell their members, no, we don't want this?
You know, over the last couple of weeks, I have been talking to so many people who, once they know what is in this bill, they are so frightened about what it means for their families, for what it means for them, and what it means for providing care. And I'll just give you a couple of examples of the people that I've talked to over the last couple of weeks. I talked to a doctor who was describing just how she had a day full of people in tears worrying about whether or not their children were going to have health care after this bill passes, and her feeling like, I cannot give them assurances that things are going to be okay, because they're not going to be okay. I think you're hearing from hospitals that are really starting to understand what the implications of the Senate bill or the House bill would be on their lives and livelihoods. And I want to stop by really explaining what that means. In this country today, over the last 4 years as CMS administrator, I talked to so many hospital executives, to members of Congress who were trying to save their hospitals. Many hospitals, Medicaid and Medicare are a lifeline. They cannot keep their doors open if they do not have funds from those programs. And we already have issues where women have to travel distances to get maternity care, to deliver their babies. We have places where people, if there's a snowstorm or a flood or any kind of issue, they already have trouble getting to their hospital. This bill is going to close an estimated 300 hospitals. Could be even more than that. So when people know this, when they think about what it means for them, their families, their own ability to make sure they get their mental health medications, do we really want to make it more difficult for people in this country to seek treatment for things that we all as a society want to make sure? We want everybody having their mental health treatment. We want every mom delivering her baby safely. We want everybody to be able to go to work and be able to live their best lives. And healthcare is one of the key ways that happens.
I mean, nail on the head, Congresswoman. It is. I know we talk a lot about the cost of this bill, and the cost is, and we have to talk about the cost because the way in which the taxes are being paid for is $1 trillion cut to Medicaid, Medicare, and Obamacare. The Affordable Care Act, and the Affordable Care Act. Yes, the Supreme Court did some stuff on Friday, but this bill, the Senate version, is cutting that. But the second biggest source of income to pay for these tax cuts is, as Chiquita just detailed, they're basically imposing more taxes on the states that the states cannot afford.
They cannot afford it. 42% of Michigan's budget right now is from the federal government.
Yes.
And I think what Chiquita just did, and what I want to do is put the human face on this. I mean, the hospitals are very engaged. I've been working with them. Children's Hospital in Michigan, 75% of the patients there are on Medicaid. With the hospitals she's talking about, 300 hospitals are rural hospitals that are taking care of people that live 2, 3, 4 hours away. They're going to close. People are going to die. We need to put the human face. She talked about human face. I'm in the elevator going to my asthma doctor when a mother with a child in a wheelchair started crying with me on the elevator because she didn't know what would happen if she couldn't bring her child to the University of Michigan, and would he die? I promised her that the head of Michigan would take care of that child and called him. I made a promise that I had no ability to really make. But we need to understand there are children across this country. There are pregnant moms. There are seniors that it's the largest payer of long-term care in this country. I've had seniors come up to me and say, is my husband going to be thrown out of the nursing home if I don't have Medicaid? These are real people and real people's lives.
Can I just say, I think about the fact that over the weekend we were talking about the firefighters that were shot and fighters responding to a fire, and that was in a remote part of Idaho. The hospital that those firefighters were able to go to that will potentially that will save their lives. The reason that they are still able to fight for their lives right now, that hospital is on the chopping block because of this bill. That's how real it is for people out there.
Yes, and I think when we talk about putting a face to it, Chiquita, that is in this last short window here about hoping that lawmakers understand what is really at stake. You had letters from Louisiana hospitals being sent to Speaker Johnson warning him about these cuts to Medicaid. Steep cuts will force consolidation of services, staffing reductions and closures, reducing health care access to everyone in our communities. Our rural communities will especially feel the impact. The potential impact will be felt by everyone in the state. Clearly, the Speaker unmoved by that. It first becomes about trying to move them. If this legislation passes through the Senate, if it passes through the House, becomes about sharing that same message with the voters. Voters will feel it in their own lives. That mom whose child is asthmatic, she will feel it in her own life. But there is an outer circle of voters who will need to be messaged to in order to understand what Republicans have really done here.
It's so difficult, and you are right to say that there are millions of people who are going to feel these effects. I think, again, we're all going to feel them, but will we know that it's because $1 trillion was taken out because of this bill? I mean, it's called a tax bill, but it is the largest cut in health care in history since Medicaid and Medicare are about to celebrate their 60 years of being in operation. And this is the largest cut to Medicaid that we've had in our history. And it's just incredibly important for people to know that Medicaid supports, just as you're hearing from Congresswoman Dingell, millions of Americans, seniors, moms, the children's hospitals, rural hospitals, all of us at the end of the day. Because when you have people who don't have coverage, either through Medicaid or the Affordable Care Act, we have 100 million people at the end of the Biden administration who are covered under one of the programs. 100 million people. We are putting in jeopardy the ability of our country to have secure health care. And again, it affects us all.
Can I just ask you, did you see the tweet from Musk saying he is ready to primary anybody who votes for this?
You know, I have very mixed, I did see it, and I have very mixed reactions because I think a lot of people in America, unfortunately, feel about him the way that I do. But I hope Republicans are listening to him the way I think they're torn. They know they're going to lose in general elections. They're afraid of primaries. I hope that they get a backbone and stand up for what's right. And I hope that we will have many ways to make Republicans understand that they're accountable to the people and their votes matter.
Do you think we could still see someone tonight stand up and do what's right?
I'm praying. I hope spring's eternal, and we don't know how several senators are going to vote. We got people, again, who are worried about the Medicaid cuts, people who are worried about the budget. We just need 2 votes, and I'm praying until that final vote.
It's a slap in the face to the voters that put them in office, that the Congresswoman and many others are out here on a hope and a prayer tonight, praying that the senators, the Republican senators in the United States Senate, do their job and stand up for their constituents.
Can't be afraid to do their job. That's what's happening now out there in America. I am who I am. I tell people what I think. I'm not afraid to defend my votes, and we need people who are going to stand up and do what the people want us to do.
What would you do if you were Dems? What would you do?
If I were who?
If you were Democrats, if you were Democrats and Republicans passed this.
Let me just say, I know we have to go, but let me just say this. When you were sitting here with Chairman Martin and you said, but catching up on the legislation, the reality is that those people out there in rural America, people that voted for, everybody, if your Republican senator is not Tom Tillis, right now, you should be questioning what you voted for. The people that voted for Mike Johnson, there is a responsibility of the Republican voters that put these people in office. They are showing you who they are. And so I also think Democrats are going to do what they can do what they're going to do. They're going to, unfortunately, use the opportunity of this terrible bill that might potentially become terrible legislation. And they could potentially now take back the Senate, which is crazy. But in the interim, the voters, they have to have some responsibility here.